The liver is the only organ in the body with a remarkable capacity to regenerate. If up to 70% of the liver is surgically removed, it can regrow within weeks. Yet despite this exceptional regenerative ability, over the course of life the liver still accumulates damage, gradually loses function, and eventually loses part of its regenerative capacity. This decline happens because of fat accumulation, alcohol exposure, viral infections, diabetes, and chronic medication or drug toxicity, all of which slowly but steadily stress, injure, and exhaust the liver. That is why I will share the top 5 strategies to clean the liver maximally, protect it long-term, and keep it as healthy as possible for life. The liver looks like a universal factory in our body. When we eat, it creates fuel, storing and releasing glucose. When we have no food, it produces ketone bodies from fat, helping the body burn fat and lose weight. When we exercise, the liver supplies building blocks and energy substrates for our muscles, supporting recovery, adaptation, and muscle growth. When toxins enter the body, the liver detoxifies them. When we take medications, the liver processes and neutralizes them, making them less harmful and easier to eliminate. When we drink alcohol, the liver converts ethanol into less harmful compounds, protecting the body from acute toxicity. The liver also acts like a scanner and a checkpoint for the entire organism. It filters blood, screens for bacteria, traps microbes, and removes toxins and debris. It is a true portal checkpoint for the bloodstream, monitoring, filtering, protecting. Because the liver is so universal, central, and metabolically active, problems also arise. One of the most important and most common problems is fat accumulation in the liver. This process is often silent. Fat gradually accumulates inside liver cells, causing cellular stress, inflammation, and metabolic disruption. If this process continues, fibrosis develops. Over time, cirrhosis may form. Scar tissue replaces functional liver tissue, the architecture of the liver changes, and the organ gradually loses its regenerative ability, its flexibility, and its function. If you name the single most important measure you can take for your liver, independent of weight, alcohol intake, viral infections, or medication use, the strongest association with liver disease is belly fat, also called abdominal fat and visceral fat. The more abdominal fat you carry, the higher your risk of liver disease. This is because visceral fat releases inflammatory molecules, free fatty acids, and metabolic signals that travel directly to the liver. These substances promote fat accumulation inside liver cells, increase oxidative stress, amplify inflammation, and over time, drive fibrosis. Fibrosis means that normal liver cells are gradually replaced by non-functional structural tissue, by scar tissue, which damages the liver permanently, alters its architecture, and reduces its regenerative capacity. That is why, if you want a healthy liver long-term, you should keep your waist circumference below 94 centimeters if you are men, and below 80 centimeters if you are women. You should keep your fasting insulin level below 10 microunits per milliliter and your triglycerides below 100 milligrams per deciliter, levels considered metabolically favorable, liver protective, and anti-inflammatory. The second most important thing you can do for your body and for your liver is regular coffee consumption. Consistent, daily, moderate, about 3 cups per day, unsweetened, without sugar. Large epidemiological studies and meta-analyses consistently show that regular coffee intake lowers liver enzyme levels, which reflects lower inflammation, less cellular stress, and better liver health. It slows fibrosis, reduces progression towards cirrhosis, and even lowers the risk of liver cancer. This happens because coffee contains antioxidants such as chlorogenic acids, along with caffeine and polyphenols. These compounds reduce oxidative stress, dampen inflammatory signaling, and suppress hepatic stellate cell activation, the key driver of fibrosis. Through these mechanisms, coffee helps slow scar formation, tissue remodeling, and fibrosis progression. Even regular intake over several months can mildly reduce inflammatory liver enzymes and improve metabolic markers. Filtered coffee is generally preferred. Boiled coffee still has benefits, but may increase cholesterol due to diterpenes. Espresso also provides benefit, and decaffeinated coffee offers partial protection, though not the full effect seen with caffeinated coffee. The third thing you can do for your liver is to minimize alcohol consumption, preferably keep it near zero. Alcohol is different from most other toxins. When you drink it, it is converted into acetaldehyde, a highly reactive and toxic compound that directly damages liver cells, damages proteins, damages DNA, and directly stimulates fibrosis. That is why regular, repeated, chronic intake of alcohol acts as a direct toxin to the liver. Other toxins may enter the body occasionally, but they are not usually consumed daily, not socially normalized, not repeatedly delivered straight to the liver in the same way. Alcohol is. Even several weeks of regular drinking can elevate liver enzymes and promote fat accumulation in the liver. 5 to 10 years of heavy alcohol use is often enough to progress liver disease into fibrosis and eventually cirrhosis. There is no truly safe dose for the liver. Even 1 glass per day, taken regularly, can contribute to oxidative stress, inflammation, and cumulative injury over time. It is especially important to limit alcohol when taking medications. The liver must metabolize both alcohol and drugs, and when they are combined, the toxic load multiplies. For example, paracetamol, acetaminophen, combined with alcohol, increases the formation of toxic metabolites, sharply raising the risk of acute liver injury. Statins, antibiotics, antifungals, and many pain medications already require hepatic metabolism. Adding alcohol increases enzyme stress, oxidative burden, and inflammation. Alcohol should be strictly limited, ideally avoided, in the presence of hepatitis viruses such as hepatitis B or hepatitis C. In these cases, the liver is already under immune attack and chronic inflammation. Adding alcohol accelerates fibrosis, speeds progression to cirrhosis, and significantly increases the risk of liver cancer. The combination of viral inflammation, acetaldehyde toxicity, and oxidative stress creates a triple hit: faster cell injury, faster scarring, faster loss of function. So the principle is simple and firm: less alcohol, less toxicity, less fibrosis, and a stronger, cleaner, longer-lasting liver. The fourth important thing you can do for your liver is the intake of vitamin E, around 800 international units per day in a therapeutic context. Vitamin E is a fat-soluble, strong antioxidant. When a person has fatty liver, the liver cell membranes undergo lipid peroxidation, a chain reaction of oxidative damage to cell membranes that triggers inflammation, activates hepatic stellate cells, and promotes fibrosis. Vitamin E interrupts this lipid peroxidation chain reaction, neutralizes free radicals, reduces inflammatory signaling, and protects the liver cell membrane. It is especially effective in people with non-alcoholic fatty liver who do not yet have diabetes and who are in earlier stages of metabolic liver injury. The time frame for benefit is usually at least 6 months and often around 12 months of consistent intake. However, vitamin E is not effective in alcohol-related liver disease and has limited benefit in advanced cirrhosis, where structural damage is already dominant. It is also important to distinguish therapeutic dose from dietary dose. The therapeutic dose used in studies is about 800 international units, not 100 international units. 100 international units reflects a general supplement or dietary support dose, whereas therapeutic intervention requires a higher dose under medical supervision. At higher doses, there are potential risks. Long-term high-dose vitamin E has been associated in some studies with a signal for hemorrhagic stroke and a possible prostate cancer signal in certain populations. That is why supervision, individual risk assessment, and time-limited therapy are important. For many individuals seeking liver support without increasing long-term risk, a moderate range, such as 200 to 400 international units per day, may provide antioxidant benefit, membrane protection, and metabolic support, with a lower likelihood of the risks seen at very high doses. The fifth important support for the liver is milk thistle, one of the most popular liver supplements. It can indeed lower liver enzymes such as alanine aminotransferase and aspartate aminotransferase, reflecting reduced inflammation and cellular stress, but it has not consistently shown histological improvement in fibrosis or steatohepatitis. The active component complex of milk thistle is silymarin. Silymarin has a strong antioxidant effect in hepatocytes, stabilizes cell membranes, makes hepatocyte membranes less vulnerable to injury, and provides a protective coating effect. It also has anti-inflammatory action. Although there is some anti-fibrotic signal, this effect is generally mild and supportive, not primary. Milk thistle works best in people with mild enzyme elevation, which is common in fatty liver, as an adjunct therapy alongside weight reduction, fat reduction, and improvement in insulin resistance. It can also be useful for people who cannot use vitamin E or who have concerns about higher dose vitamin E therapy. The typical dose of silymarin is about 420 milligrams per day, ideally split into 3 doses of 140 milligrams, a classical and widely used regimen. Sometimes doses are used up to 600 milligrams per day. It is important to choose a product that states standardized silymarin dosage, not just milk thistle powder. Effects on liver enzymes are often seen within 4 to 8 weeks. Silymarin is generally safe, well tolerated, and metabolically neutral, though some people may notice mild bloating. Because it can influence the cytochrome enzyme system, it should be used with caution in people taking narrow therapeutic index drugs such as warfarin, certain sedatives, and some diabetes medications. Another important supportive compound is N-acetylcysteine. N-acetylcysteine acts as a precursor to glutathione, the liver's central detoxification antioxidant. It helps replenish glutathione stores, reduce oxidative stress, and support detoxification pathways. It is well established in acute liver injury, especially paracetamol toxicity, but also shows supportive benefits in fatty liver, oxidative stress states, and metabolic inflammation. In this context, it works as a protective, stabilizing, and detox-supporting agent for the liver.